what will another Trump term mean for black women in Africa in terms of sexual reproductive health and abortion in particular? Now, the global gag rule prohibits foreign NGOs which receive U.S. global health assistance from providing legal abortion services or referrals. To explain this even further, I'm now joined by health journalist Pontsho Pilane. Pontsho, very good morning to you. Thank you so much for your time. What does the gag rule mean? Why should we care, especially when it comes to the reproductive health services in South Africa?
Thank you so much for having me. So the global gag rule, or as it's formally known, it's the Mexico City policy, is a policy that was last implemented by George Bush until President Donald Trump implemented it in 2017 when he took over. And it essentially blocks U.S. global health assistance funds, so U.S. global foreign aid, to help any foreign NGOs, so non-U.S. NGOs, to promote abortion in any way, except in the cases where rape, incest, or there is a serious threat to the life of the pregnant person. And this includes counseling or even referring someone to a facility where a safe abortion can take place. And this includes when, let's say I have an NGO and my NGO gets a little bit of U.S. money, but I don't use U.S. money for promotion and promotion of abortion services. I can't even use other donor money for it. So it completely blocks any kind of abortion health services promotion from happening, regardless of whether it is using U.S. funds or not.
So, in essence, what will then another term of President Donald Trump mean when it comes to black women in Africa in terms of sexual reproductive health?
So a lot of funding comes from U.S. A lot of global health assistance funding comes from the U.S. for a lot of NGOs in South Africa and in Africa as a whole. And what this means is that when Donald Trump took office in January 2017, like I said, what he did is he expanded the global gag rule to say that you can't do this. And what we've seen over the past years is that every Republican president puts in place the global gag rule for every Democratic president to kind of rescind it. So this is a back and forth that happens. What we're fearing is going to happen, particularly now in the case, is that we're going to see devastating impact on the lives and freedoms of girls and women across the world. This means that if I am an NGO, like I said, that has received U.S. funding and I was doing abortion work at any kind, that I will have to stop doing the abortion work that I'm doing. That means that there's less abortion services that are happening in the country. And what the most implication is that a lot of NGOs do what we call integrated health services. What we mean by this is that they don't just do abortion services, they do abortion services with HIV counseling, with providing services for contraceptives and other primary healthcare needs or sexual reproductive health needs of young women, or what we call key populations, and this is people who are most at risk of contracting HIV. And then in this case in South Africa, we're talking about men who have sex with men, we're talking about sex workers, and we're talking about young women and girls, because those are the three key populations that are at most risk of contracting HIV. So it's not just that abortion services will be kind of curtailed. We're also curtailing essential services like HIV testing, which really takes us back in terms of our everything, our sexual reproductive health, but as well as our overall health. We already know that South Africa has the highest HIV population in the world, or rather the highest HIV treatment program in the world. And we have about 7.8 million people who are on HIV treatment.
As you speak about abortion in itself is a very sensitive topic, and there are many conversations as to why abortion needs to continue to be funded and why it's so important. Talk to us a little bit about some of those reasons and the importance of highlighting the need for abortions and the circumstances that surround it.
Abortion is an essential service. It's a health service. We have the Choice of Termination of Pregnancy Act in South Africa, right? One of the most liberal or progressive abortion acts in the world that says that a woman can get an abortion, or a person can get an abortion at any time, at any stage of pregnancy, right? Particularly under 12 weeks, for any reason rather, and that under 20 weeks that they can, unless there is any kind of serious medical reasons, they can't get abortion. So when abortion is a medical service that we need to provide, or that needs to be provided to people who have uteruses and can be pregnant. With the person who's pregnant. Therefore, if we are unable to, as people who can be pregnant or not, choose our right to remain pregnant when we do fall pregnant, it is an important service or right. Therefore, it's as if I asked you that, if you asked me, why is it important that we get vaccination for babies or immunization programs? It's a health service, and our law provides for it. It's the most liberal laws or kind of provision, even though there's still issues around. When you talk to sexual reproductive health activists, they'll tell you that the implementation is not as great as it is on policy. So it's a health right like any other right. And I think the controversy is around the moral or the ethical debate around abortion. But if you look at abortion as a health service, as me going into a clinic, or anyone who wants to going into the clinic and asking for a health service, that's why it is important. It is the reason women or people with uteruses should be able to make a decision about when they want to fall pregnant, if they want to fall pregnant, and when they choose not to be pregnant.
And very lastly, Pontsho, as we assess the health space and we speak to the rights of women, and we also bear in mind the gender-based violence numbers that we're seeing in South Africa and worldwide, what do you believe are some of the social issues and social aspects that still need to be learnt, and perhaps behavior that still needs to be taught about health and women and rights and the laws that allow women to do as they please when it comes to their bodies?
Yes, you asked such an important question, particularly in the context of the global gag rule, right? Like I said, every Republican president has reinstated it, and every other Democratic president has rescinded it. And this back and forth has been happening. And at the core of it is, we need to be able to, and by we, I mean people with uteruses, and in general, women and girls need to be able to make decisions about our bodily autonomy, what we want to do with our bodies, when we want to do it, how we want to do it, and with whom we want to do it, right? And when there are laws or policies that are being made by leaders, global leaders, or very powerful global in the context of global politics, very powerful countries like the United States, we need to think about what is the implication on the autonomy, the bodily autonomy of young women, girls, and people with uteruses, and marginalized populations in general. So the biggest thing is, as we go into these elections, or as we go into watching these elections and looking forward to the results, particularly what's happening in the US, is that we need to realize that it's not just what's happening in South Africa or in our continent that impacts how or what happens to our bodies, that our leaders, our presidents, our global leaders have the responsibility, or have the power rather, not the responsibility, to make decisions about our bodies. And we need to be in a position to know what are the powers that they have and how they affect us, and how we can fight back if needs be. Like I said, research is already showing that in the past 4 years of the Trump presidency, that the sexual reproductive health services have deteriorated in many areas. There's been recent research that showed that there's been NGOs in sub-Saharan Africa that have had to completely close shop because they were fully funded by US funds, and therefore when they said no to signing onto the global gag rule, they were unable to operate. But this has far-reaching consequences on the quality of life of people in communities, and of women in particular. And therefore, we really need to think very carefully about what these implications are, and how we can then use our power at the ballots, if we do vote, to make sure that we do not have harmful practices or harmful policies being put people with harmful policies being put in power.
Very well. Thank you so much for your time and for sharing sharing that insight. The global gag rule explained there by Pontsho Pilane, a health journalist, speaking to the positioning and the strategy that is being enforced by US President Donald Trump.